Welcome to an introduction to telemedicine. This brief module will present an overview of several uses of telemedicine and telehealth, and will introduce you to terms used in this field. More specifically, the information in this module will define the distinct difference between telehealth and telemedicine. You will also see how to identify, characterize, and define various ways telemedicine is used in real time or not in real time. And we will discuss what you need to know in order to start a successful telemedicine practice. Telemedicine use dates to 1905 in Europe when physicians transferred electrocardiograms, yet telemedicine's first clinical application was in cardiology. Norway, France, and Italy followed to use telemedicine through radio consultations between 1920 and 1940. We saw our first successful telemedicine trials in the United States in the 1950s. The terms telehealth and telemedicine are often used interchangeably. While it's not entirely wrong, I want to provide a more specific definition for each term. Telemedicine is the use of healthcare information exchanged from one site to another through electronic communications for the health of a patient and to improve patient care, treatment, and services. For example, in teleradiology, telepsychiatry, or teledermatology. Telehealth, on the other hand, includes the delivery of health education through video conference. Many types of technologies are used to deliver telehealth and thus telemedicine. They include cameras, computers, and mobile medical devices, such as biosensors, to deliver electronic updates from the patient to the physician at regular intervals. Telemedicine is considered the provision of remote clinical care. Telemedicine is defined by the American Telemedicine Association as the use of telecommunication and information technologies to provide clinical healthcare at a distance. Depending on the state in which the provider is practicing, there may be limitations on the services that can be delivered, and certain states may require special waivers to perform telemedicine. Telemedicine can be used for acute care and injuries as well as monitoring chronic conditions. Telemedicine, as you will see, is an excellent way to deliver care to rural populations. Telehealth is typically defined as a support service and is often provided by non-clinical health providers, such as medical assistants. It can be seen as supplemental to telemedicine and can include medical education, administrative care, or training. Telehealth incorporates the ability to deliver continuing medical education and to offer in-services and seminars to both providers and to medical staff. Let us look at the first category of telemedicine. Synchronous telemedicine is the category that most people think of when telemedicine is mentioned. Just like the name implies, it denotes when a patient and physician interact in real time, such as through phone or video. Some of the types of synchronous visits are teleconsultation, telescreening, a kiosk video visit, urgent care video visits, a group visit, multi-provider video visits, and virtual rounding video visits. These interactions can be scheduled ahead of time or may occur as needed. Examples include a patient speaking with the on-call provider after clinic hours, a nurse practitioner giving the patient their clinical lab results, a medical provider following up with a patient after surgery, or a psychiatrist conducting medication checks and behavioral therapy with patients from the convenience of the patient's home or office. There are numerous benefits for patients who are seen through synchronous telemedicine. It resembles an in-person visit to the closest degree of the three categories we will discuss. A real-time consultation may yield the best use of both parties' time and may incentivize new patients to a practice. Lastly, reimbursement tends to be easier when claimed using this method. Now we will define asynchronous telemedicine, which is the second category. Asynchronous telemedicine is also referred to as store and forward. This method can still use the same communication mediums as synchronous, and even broader ones not typically found in synchronous, such as images and short videos. Store and forward telemedicine is useful for radiology and for dermatology, where detailed images and photos are needed for a particular diagnosis. The key difference between synchronous and asynchronous methods is a medical provider and patient do not have to be available at the same time. This can seem convenient to both parties. However, physicians have shown to take longer to work through video and voice recordings as opposed to raw data. Inherently, asynchronous applications are not always considered telemedicine to many payers, but still may be utilized to deliver meaningful services. The benefits of asynchronous telemedicine come from higher convenience and access to care. These afford a practice to be able to grow its patient pool while also reducing physician overhead cost. Additionally, all patient-provider interactions are recorded and usable in cases for malpractice or insurance purposes. In applying asynchronous telemedicine, users must be aware of specific limitations. The completeness of diagnostic and treatment assessments can be limited by the receipt of incomplete or insufficient patient information. Also, with the nature of data relay back and forth from the patient and physician or physician to physician, there may be information delays. Authorization for asynchronous telemedicine varies from state to state, and physicians should check with their medical boards for the most up-to-date policies. Asynchronous telemedicine helps to refine patient workflows. This means that there are increased time savings and providers have more flexibility with their schedules, as they can incorporate additional appointments and increase efficiency in treating patients. Remote patient monitoring, or RPM, is the third type of telehealth category. With RPM, devices are given to the patient to take home and are left in a central location that is easily accessible. The data are transmitted asynchronously or synchronously to the provider. Many times, the data are gathered passively with no action needed from the patient. The goal is to preemptively detect and alert providers of a change in the patient's condition, if the batteries are low in the patient's device, or if the device is not functional. Let us look at an example data flow in RPM. The data are transmitted from the patient to the device in the patient's home, which is then transmitted to a monitoring center. The center receives a great deal of data, but the providers may be notified only in case of emergency. There is also a dashboard that shows patient progress, with a detailed and frequent history of the patient's biometrics and other body measurements. This method could yield faster responses and more accurate triages. Remote patient monitoring is the third type of telemedicine that includes the use of devices to track and report health conditions in an outpatient setting. Typically, remote patient monitoring occurs in the home of patients or at a community living center. An excellent use case for remote monitoring occurs in glucose monitoring for diabetic patients and in implantable devices for heart disease. Typical data that are tracked include movement or steps taken, heart rate and blood pressure, hours and quality of sleep, body temperature, respiration rate, brain activity, and blood glucose. Many consumer products have become more useful post-pandemic for remote patient monitoring. It is often helpful when patients can see their progress and make lifestyle modifications in real time. Dashboards can be designed to report on multiple patients in real time or at intervals. Telemedicine has been a part of emergency medical services for several years. Data can be sent to providers to alert 911 and later when EMS is on the scene. This helps to deliver faster and more efficient care. Radio frequency identification and Bluetooth are often used to support the devices. Radio frequency identification, or RFID is defined as a wireless system that consists of tags and readers. The reader has one or more antennae that emit radio waves and receive signals back from RFID tags. The tags use radio waves to communicate their identity to nearby readers and can be active or passive. Passive RFID tags are powered by the reader and do not have a battery. Active RFID tags use batteries. Bluetooth technology is a short-range wireless communication technology that replaces the cables connecting electronic devices. The Bluetooth radio frequency transceiver operates in the unlicensed ISM band center at 2.4 GHz, like a microwave. There is a frequency hopping transceiver to combat interference and fading. Both can be used to transmit data from patient devices to a home-based unit. The main advantages of remote monitoring are getting higher patient compliance rates. They are at the convenience of their house and not using a bed in the hospital. The providers can get early alerts of patient status, earlier discovery and prevention, and they can assess the patterns and tracking of weight and blood pressure over time. The hopes of preventing readmissions and fewer ED visits, and the fact that the physician can adjust the treatments, therapy, and medications to prevent readmissions are highly beneficial. Here are 3 case examples of where remote patient monitoring is often used. A patient with congestive heart failure and/or hypertension. A patient with chronic obstructive pulmonary disorder. And for a patient with new onset atrial fibrillation and type 2 diabetes. There are considerations for patient privacy. Some applications focus on monitoring sleep time, lack of movements, and in the case of behavioral health, assessing mood during regular intervals. While this may seem obtrusive, remote patient monitoring in this case can be a highly proactive and valuable application. When selecting any telemedicine system, here are the things you should consider. What are the laws in my state? Where will my practice be located? Will I see patients in their homes, or at another facility, or at a school? What services will I provide? What demographic? And what conditions will I see? What platform will I use? Now let's talk of other ways telemedicine can be used for communication. A provider-to-provider consultation occurs between physicians or providers. The interactions can occur synchronously or asynchronously. For example, a general surgeon consulting with an oncologist using a live video feed is a provider-to-provider telemedicine encounter. Another example is an emergency physician consulting with a specialist about their shared patient. The provider-to-provider-to-patient interaction involves consultation between physicians or providers while incorporating the patient into the interaction. An example of this type of consultation would be a stroke neurologist examining a patient through telemedicine while the emergency room physician is physically present during the video encounter. A provider-to-patient or provider-to-consumer encounter is a face-to-face encounter between a provider and a patient through a web camera, robot, cart, or other video technology. The encounter occurs regardless of the patient's location or acuity level and can occur synchronously or asynchronously. It can also include continuous monitoring of patients with a visual monitoring device like a camera. An example of this type of video surveillance commonly occurs in the intensive care units or in a neonatal intensive care unit. Let's discuss some common terms used in telemedicine. The originating site is the location of the patient at the time the service is being delivered. The distant site is the location of the physician or other licensed practitioner delivering the service. The same standard of care must be met for a telemedicine visit. So if this means the physician needs assistance at the originating site, such as performing a physical examination, someone must assist from the patient location, even if the originating site is the home. A telepresenter is a trained and licensed professional, usually a nurse or certified nurse assistant, who assists in conducting a telemedicine visit. Mobile health is defined as the use of mobile and wireless technology to support the achievement of health objectives. This means we can use mobile phones and tablets to improve health outcomes, services, and research. In rural areas, it is more common for patients to use their cell phones or other mobile devices for a telemedicine visit, as opposed to a desktop computer or a laptop. Cellular signals can be stronger than internet or Wi-Fi in some remote regions. The rules for reimbursement are very important. We will dive deeper into each one of these areas in a separate module. However, you can see that the type of transaction, where the patient is located, how the clinician is communicating, and the role of the clinician are all very important factors in maintaining a sustainable telemedicine program. Protected Health Information, or PHI, should be thought of as all digitally stored and tracked data which is medical and could be identifiable unless otherwise scrubbed of patient identifiers. HIPAA-covered entities include healthcare clearinghouses, health plans, health insurers, and medical service providers. PHI is comprised of two parts: medical care information and identifying information. The Health Insurance Portability and Accountability Act, or HIPAA, has three major goals as it pertains to PHI: to protect health information, to standardize electronic transactions, and to enforce the Act with financial penalties. Now we will discuss specific aspects of the HIPAA privacy rule. PHI must be de-identified before being released to the public or released to another organization outside of the formal business working relationship. If you are unsure of who is formally working within your organization, it is a good time to consult your administrator. The HIPAA security rule covers the following areas. First, the administrative area covers policies such as risk assessment. Second, the physical environment. This includes physically accessible devices, such as facility access controls, employee workstations, device and media controls. This includes your mobile devices and your cell phones that may be used to capture a patient image for transfer. And lastly, the technical. This refers to workstations. Think of password protection, privacy screens, encrypted hard drives. Basically, this is how you are going to transmit your data. In summary, telemedicine is medical care, while telehealth typically includes support or ancillary care and medical education. Remote patient monitoring can be an important tool to monitor patients outside the hospital. And lastly, security and privacy must be a consideration when establishing any new telemedicine practice. Here are a few questions for review. What are two differences between telemedicine and telehealth? Name two patient populations where remote patient monitoring would benefit. What reimbursement criteria must be considered before establishing a new practice?